Welcome to Dr. Medic. Today we are going to see about the femur bone. Femur or thigh bone. It is the longest and strongest bone of the body. The femur has upper rounded end, lower bicondylar end, long shaft with convex forward. Try determination. Upper end is rounded head, lower end is expanded to form two large condyles. Head is directed medially, shaft is cylindrical, convex forward. Anatomical position. Head directed medially upwards and slightly forward. Shaft directed obliquely downward and medially so that lower surfaces of the two condyles of femur lie in the same horizontal plane. Upper end. Upper end has head, neck, greater truncal, lesser truncal, intertruncal line, intertruncal crest. Head is directed medially upwards and slightly forward, articulate with acetabulum to form the head joint. It has fovea, which is the roughened plate situated just below and behind the center of the head. Neck connects the head with shaft 3.7 cm long. Neck has two borders and two surfaces, upper border and lower border. Upper border is concave and horizontal, meets the shaft at greater truncal. Lower border, straight and oblique, meets the shaft near the lesser truncal. Neck has two surfaces, anterior and posterior surface. Anterior surface is flat, meets the shaft at the intertruncatic line, entirely intercapsular. Posterior surface, convex from above downwards, concave from side to side, meets the shaft at intertrochanteric crest. Neck shaft angle 125 degree in adults, less in females because due to their wider pelvis. The angle facilitates movement of a hip joint strengthened by a thickening of bone called the calcaire femoral present among its concavity. Truncal shaft angle, which is 8 degree in adults. This is more important in the radiological parameter, which provides the idea of direction of medullary canal and its alignment with the greater truncal. Angle of femoral torsion or angle of anteversion is formed between the transverse axis of the upper and lower ends of the femur is about 15 degree. Blood supply. Intercapsular part of the neck is supplied by retinacular artery, derived chiefly from the trochanteric anastomosis. Vessels produce longitudinal groove and foramina directed towards the head, mainly on anterior and posterior superior surfaces. Extracapsular part of neck supplied by ascending branch of the medial circumflex femoral artery. Greater truncal. Large quadrangular prominence located at upper part of the junction of neck with shaft. Upper border lies at center of the head. Upper border with an apex has three surfaces, which is anterior, medial and lateral. Apex. Intertuned posterior part of the posterior border. Anterior surface, rough in its lateral part. Medial surface, rough impression above and deep trochanteric fossa below. Lateral surface, crossed by oblique ridge directed downward and forward. Lesser truncal, conical eminence directed medially and backwards from the junction of posterior-inferior part of neck with shaft. Intertrochanteric line marks the junction of anterior surface of neck with shaft. Prominent roughened ridge begins above at anterosuperior angle of the greater trochanteric F tubercle. Continues below with a spiral line in front of the lesser truncal. Spiral line winds around the shaft below the lesser trochanter to reach the posterior surface of the shaft. Intertrochanteric crest marks the junction of posterior surface of neck. Smooth rounded ridge begins above posterior superior angle of greater trochanter and ends at lesser trochanter. Round elevation above its middle is called the quadrate tubercle. Shaft, which is cylindrical, narrowest in middle, more expanded inferiorly, convex forwards, directed obliquely downward and medially. Shaft has three parts: upper one third, lower one third, middle one third. Upper one third of the shaft. Two lips of linea aspera diverge to posterior surface. Upper one third of shaft has four borders: medial, lateral, spiral line, and lateral lip of gluteal tuberosity, and four surfaces: anterior, medial, lateral, and posterior. Gluteal tuberosity. Broad roughened ridge on lateral part of the posterior surface. Medial one third of shaft. It has three borders: medial, lateral, posterior. Medial and lateral borders are rounded and ill-defined. Posterior border is broad, roughened ridge. It has linea aspera, which is the two lips that has medial and lateral linea aspera. Three surfaces: anterior, medial, and lateral. Medial and lateral are directed backwards than towards the sides. Lower one third of the shaft. It has two lips of linea aspera diverge as supracondylar lines to encloses an additional surface, which is called the popliteal surface. It has four borders: medial, lateral, medial supracondylar line, and lateral supracondylar line, and four surfaces: anterior, medial, lateral, and popliteal surfaces. Medial border and medial supracondylar line meets inferiorly to form medial surface, and lateral border and lateral supracondylar line meets inferiorly to form lateral surface. Lower end of the femur. The lower end has articular surface, medial and lateral condylar, intercondylar fossa or intercondylar notch. The lower end is wildly expanded to form two large condyles, which is medial and lateral. These two form articular surface for knee joint. So now we got articular surface. Anteriorly, two condyles united and are in line with the front of shaft. Posteriorly, separated by a deep gap, which is intercondylar fossa or intercondylar notch. Articular surface of lower end of the femur. Articular surface has two condyles and that has two parts: patellar part and tibial part. Patella covers the anterior surface of both condyles, extends more on lateral condyle than medial. Between two condyles, surface is grooved vertically, separated from tibial surface by two faint grooves. Tibial parts covers the inferior surface and posterior of two condyles and merge anteriorly with patellar surface. Part of surface over the lateral condyle is short and straight anteroposteriorly. Part over medial condyle longer, curved with its convexity directed medially. Lateral condyle flat laterally and more in line with shaft. Takes greater part in the transmission of the body weight to tibia, though it is less prominent than the medial condyle, stouter and stronger. Lateral aspect presents the following: prominence lateral epicondyle, popliteal groove lies just below epicondyle, deeper anterior part and shallower posterior part. Muscle impression posterior superior to the epicondyle. Medial condyle convex medially, prominent point is medial epicondyle. Posterior superior to the epicondyle, there is a projection. It's called the abductor tubercle, which is a landmark. Epiphyseal line for the lower end of femur passes through it. Intercondylar fossa or intercondylar notch. Notch separates the lower and posterior parts of two condyles. Limited anteriorly by patellar articular surface, posteriorly by the intercondylar line, which separates the notch from the popliteal fossa. Separates the notch from the popliteal surface. Attachments of the femur. First one is the fovea. Fovea has ligament of head of femur or round ligament or ligamentum teres or femoris. It's just one ligament but has a different names. Attachments of the greater truncal. These muscles are insertion muscles. First one is the piriform. which present in the apex of the greater trochanter. Second one is the gluteus minimus, which present in the rough lateral part of the anterior surface, and gluteal medius, which present in the ridge on lateral surface. Trochanteric bursa presents behind the ridge. Obturator internus and two gemelli, which present in the upper rough impression on the medial surface. Obturator externus present on the trochanteric fossa. Lesser trochanter. Psoas major is the first muscle inserted in the apex and medial part of rough anterior surface. Iliacus inserted in the anterior surface of base of trochanter and on area below it. Bursa covers a smooth posterior surface, lies deep into upper horizontal fibers of adductor magnus. Intertrochanteric line. Capsular ligament of hip joint is present. Upper band of iliofemoral ligament in its upper part and lower band of iliofemoral ligament in its lower part. Highest fibers of vastus lateralis from upper end. Highest fibers of vastus medialis from lower end. Quadrate tubercle. Quadratus femoris. Muscle inserted in the quadrate tubercle. Attachments of the shaft. The first muscle is the gastrocnemius. The head origin from the medial part of popliteal surface, and it has a lateral head also. Vastus intermedius is the second muscle, arises from upper 3/4 of anterior and lateral surface. Articularis genu arises just below the vastus intermedius muscle. Vastus lateralis, we have seen it before. It arises from the part of intertrochanteric line and anterior inferior aspects of greater trochanter. The lateral margin of gluteal tuberosity, upper half of the lateral lip of linea aspera. Vastus medialis, same like a vastus lateralis, arises from lower part of intertrochanteric line, spiral line, medial lip of linea aspera, and medial supracondylar line. Gluteus maximus, inserted in the gluteal tuberosity. Adductor longus, inserted along the medial lip of linea aspera between vastus medialis and adductor brevis and magnus. Adductor brevis inserted into the line extending from the lesser truncal to upper part of the linea aspera, behind the pectinus and upper part of the adductor longus. Adductor magnus inserted medially margins of gluteal tuberosity, the linea aspera, medial supracondylar line and adductor tubercle, leaving the gap opening for the popliteal vessels. Pectinus inserted in the line extending from the lesser trunca to linea aspera. Short head of biceps femoris arises from lateral lip of linea aspera between vastus lateralis and adductor magnus and from upper 2/3 of lateral supracondylar line. Medial and lateral intermuscular septa attached to lip of linea aspera and to supracondylar lines. They separate the extensor muscle from the adductors medially and from the flexors laterally. Lower end of lateral supracondylar line gives origin to the plantaris above, upper part of lateral head of gastrocnemics below. Popliteal surface covered with fat forms floor of popliteal fossa. Origin of medial head of gastrocnemic extends to the popliteal surface above the medial condyle. Attachments of lateral condyle. Fibular collateral ligament attached to the lateral epicondyle. Popliteus, which is a tendon, arises from the deep anterior part of popliteal groove. Muscle impression near the lateral epicondyle gives origin to the lateral head of gastrocnemius. Attachments of medial condyle. Tibial collateral ligament of knee joint attached to the medial condyle. Adductor tubercle receives insertion of hamstring part or ischial head of adductor magnus. Intercondylar notch. Anterior cruciate ligament attached to posterior part of medial surface of lateral condyle on smooth impression. Posterior cruciate ligament attached to anterior part of lateral surface of medial condyle on smooth impression. Intercondylar line provides attachment to capsular ligament and laterally to oblique popliteal ligament. Nutrient artery to femur, derived from secondary perforating artery, which is a branch of profunda femoris artery. Nutrient foramen located on medial side of linea aspera and directed upwards.